And so we are going to move on to the next session. And it is supported employment, crisis services, and beyond. So throughout the meeting, we've been discussing the various aspects of crisis services. NASMHPD has also been putting an emphasis on supported employment to help reduce the risk of crisis or to help individuals stabilize after crisis. I am delighted today to introduce this session, Supported Employment, Crisis Services, and Beyond. NASMHPD has a great partnership with WSTAT and the Council of State Administrators of Vocational Rehabilitation regarding supported employment and strengthening the relationship between state departments of mental health and state departments of vocational rehabilitation. This session will provide best practice state examples of supported employment and the importance of this relationship. And I'm honored to introduce the panel. We have Robert Drake, Wendy Morris, Cora McNabb, Lori Criss, and Kevin Miller. Bob Drake is Vice President for Behavioral Health and Health Policy at WSTAT. He is also the Andrew Thompson Professor of Health Policy and Clinical Practice at the Geisel School of Medicine at Dartmouth. His work on psychiatric rehabilitation over 4+ decades includes integrated treatments for people with dual disorders, evidence-based mental health practices, and implementing vocational services. He co-developed the Individual Placement and Support IPS model of supported employment, an evidence-based practice now used across the United States and around the world. Wendy Morris is the current commissioner at the Kentucky Department for Behavioral Health, Developmental and Intellectual Disabilities. Wendy joined BHDID in 2013 as Deputy Commissioner after previously holding various leadership positions in the field of behavioral health, including inpatient, outpatient, and home health. Cora McNabb is the Executive Director of the Kentucky Office of Vocational Rehabilitation. She has 29 years of experience in the field of rehabilitation in the areas of workforce initiatives, management administration, and grant writing. Lori Criss is the Director of Ohio's Department of Mental Health and Addiction Services. She has been engaged in the behavioral health field since 1992. Prior to coming to Ohio MHAS, Lori served as the Chief Executive Officer of the Ohio Council of Behavioral Health and Family Services Providers. Kevin Miller is the Director of the Opportunities for Ohioans with Disabilities Agency. The agency is responsible for providing individuals with disabilities the services and support they need to attain and maintain employment and is charged with making determinations on Social Security disability claims. I am now going to turn this over to Dr. Robert Drake. Thank you. And I'm going to unmute. And Bob, if you could just unmute.
Okay, now can you hear me all right?
Yes.
Okay, great. Okay, well, thanks for the invitation. I'm happy to be here with you folks. I want to be a bit iconoclastic and say that rather than providing more and more crisis services, maybe we need to think about prevention. I'm a health services researcher, and for people in my field, the key question about healthcare is what we call the more is less paradox in the U.S. The U.S. spends more for healthcare than any other high-income country, but we consistently have health outcomes near the bottom. That's what the more is less paradox means. We consistently spend more and benefit less in mental health as well as in other areas. We do this by emphasizing high-tech medical treatments for problems that are inherently social problems. Crisis care is an excellent example of how we spend more and benefit less. Consider a common mental health crisis which occurs every day in numerous towns and cities across the U.S. Someone calls 911 in distress, reporting suicidal thoughts, and is subsequently transported to a hospital emergency room, often by ambulance or police and in restraints. The precipitant for this episode is likely to be a situational stressor rather than an illness. For example, a family fight, a job loss, losing a friend, a threat from a drug dealer, a financial crisis, a housing loss, and so on. Once in the emergency department, however, the individual becomes a patient with a medical issue in a medical system that requires evaluation by a highly trained professional. Once the individual, now a patient, is in the emergency room, the professional who knows little about the patient and the relevant environmental issues nevertheless has medical and legal responsibility. The easiest and safest decision is to insist on an involuntary hospitalization. The patient has now been legally committed to be transported to the hospital and will be housed in an emergency room, or even worse, some places in a jail, until a bed in the public hospital is available. After perhaps 72 hours in the emergency room, the patient goes in an ambulance or police car in restraints again for perhaps a 60-mile drive to the public hospital. In the hospital, a court hearing, further medical assessments, daily evaluations, medication trials, and other procedures ensue. After several days or weeks of hospitalization, the patient's eager to leave the hospital, and the hospital is under pressure to discharge the patient. But the community stressors that precipitated this crisis are unlikely to have been addressed in a meaningful way when the patient leaves the hospital, setting the stage for yet another crisis in the future. This amalgam of people in crisis I have treated, and they represent usual crisis care in the U.S. It's medicalized, it's professionalized, it's institution-based, it's expensive, and it's largely ineffective. Numerous evidence-based interventions can prevent mental health crises like these, can prevent police interventions, can prevent trips to the emergency room and the hospital. Among the evidence-based practices that reduce unnecessary psychiatric hospitalizations are diversion services, transition services, assertive community treatment, strengths-based case management, psychotherapy, systematic medication management, family psychoeducation, supported housing, substance abuse treatment, and on and on. Many of these individual services have been shown in research to reduce hospitalizations by 40 to 50%. Multiple interventions together should be even much more effective. The problem, however, is that evidence-based practices are rarely available in most community mental health clinics. A recent SAMHSA survey indicated that less than 3% of patients in these settings were able to access several evidence-based practices. Well, what could we do to change this system of crisis care? Let me suggest that just like in housing, 3 words should prevail in crisis care. Rather than location, 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 our mantra should be prevention, prevention, prevention. Think about it. We need healthy diets rather than more hospitalizations and surgeries for diabetes. We need more smoking prevention rather than more oxygen tanks and cancer treatments for lung disease. And we need prevention interventions to avoid mental health crises. We know how to prevent crises among people with even the most severe illnesses. Most people with a mental health disability, unfortunately, languish in their homes, apartments, homelessness settings, hospitals, jails, and emergency rooms because they lack meaningful employment and other activities. We know that boredom and unemployment make their problems worse, and employment can help them to avoid crises, relapses, and expensive service use. These people want to work and need only minimal supports. Further, we know how to help. Individual Placement and Support, or IPS, is the evidence-based intervention for helping people with mental health issues to obtain good jobs and succeed in employment. IPS is an inexpensive, easily delivered, and effective service. An employment specialist joins the mental health team and takes the lead in helping a client select a job of interest, obtain employment through a targeted job search, and be successful with a minimum of supports. The great majority of people who sign up for IPS are successful in competitive integrated employment, according to 28 randomized controlled trials now. And this includes people with significant disadvantages, such as substance abuse, homelessness, and minority status. However, despite the cost effectiveness of IPS, it's typically not available in most mental health centers. Several barriers interfere, but state departments of behavioral health or mental health and of vocational rehabilitation working together can overcome these barriers. This occurs now in many states across the U.S. The IPS Center at WestEd has been working on dissemination and implementation of IPS for several years, and there are now, I'm happy to say, about 1,000 IPS programs in the U.S. We're also currently collaborating with NASMHPD and CSAVR to expand partnerships between state behavioral health leaders and state vocational rehabilitation leaders to implement IPS programs. To access more information about connecting with other states, you can contact the leaders of this project. They are Ron Vessel from CSAVR, and Ron's email address is rwvessell@gmail.com. Stuart Gordon from NASMHPD, and Stuart's email is stuart.gordon@nashpid.com. And Deborah Becker at the IPS Center. Deborah's email address is deborahbecker@westat.com. Fortunately, we have with us today representatives from 2 states, Kentucky and Ohio, that have done great jobs of overcoming employment barriers with us to help describe how this collaboration works. So I'd like to yield the floor to Wendy Morris, Cora McNabb, Lori Criss, and Kevin Miller. Thanks very much.
All right, well, good afternoon, everybody. Can you all hear me? Great. I'm Wendy Morris here in Kentucky, and give me just a second. I'm going to share my screen with you. We have a few slides. All right. All right. Can you all see that? Is it full screen, Megan? All right. No?
If you'll click on, go ahead and start presentation, it should come up.
I did. I have 2 screens, so it popped up full on one side, but not this side.
Okay, go up to the top and click on switch views at the top of your Zoom.
I do not see that.
Okay, let's do this. Go ahead and stop sharing and then reshare and then click on the actual presentation slide. Now that you have it going, it should show you.
Nope. Oh, and we practiced this so many times.
So the green share button. You see the green share button?
Yeah.
Okay. Okay. And then on the screen, on the share screen itself, you should see 2 you should see two windows. One is the actual presentation and one is the presenter view. You want to select the one that's the actual slide. And then down at the bottom, if you can use that button as well. There's a little slide right next to the slide bar. There's a little slideshow icon right next to the minus sign. Do you see it?
No. This is.
Do you have a presenter screen up on your other monitor?
Not anymore. This is.
We have a slide deck on standby if you'd like us to go ahead and pull that up.
Go ahead and do that. Sorry about that.
Okay. Anthony, I'm stopping sharing if you want to pull that up.
Guess we should have practiced with the two screens. I was at home when we practiced.
It was a good effort. It was.
I promise y'all went really well from home. Okay, so do we have it all now? Yes, y'all can see now?
Yes, you can go now. Mm-hmm.
Terrific. Sorry about that, everyone. So I'm Wendy Morris. I'm the commissioner here at the Department for Behavioral Health, Developmental, and Intellectual Disabilities in Kentucky, and very happy to be able to talk to you for just a few minutes about what we're doing here. I'll go over just a couple, 3 slides, and then my colleague, Cora McNabb from OVR, will talk about a few slides. If y'all want to just advance to the next slide. We are very proud here in Kentucky to be celebrating 10 years of having IPS in our state. We have served over 18,000 people during that time. We currently have the program in 18 different sites across the Commonwealth. We've trained 218 IPS support employment specialists in 76 of our 120 counties, so it's in a lot of places. We have a 35% employment rate, so that's about 6,300 people who are employed, and another 4.5% who are in school, which is about 830 people. We use a team approach structured using implementation science, and for those of you who may not be familiar with implementation science, it's a process to really develop effective interventions and to be sure what you're doing is a good fit. It looks at organizational drivers, competency drivers, leadership drivers. And so we use coaches, trainers, reviewers, and again, it's a collaboration between behavioral health here at my department and the Office of Vocational Rehab. We provide technical assistance, training, and coaching with provider teams and supervisors. We do fidelity monitoring, not just to assure that the evidence-based practice is being done correctly, but also to be sure that we can hone our technical assistance and our training to be kind of in tune with what people need, and also to identify trends and patterns in Kentucky. You know, what are our barriers? Are there knowledge gaps? Are there other things we need to do at the state to make sure that things can go as they should? Of course, we benefit quite a bit from our support from WestStat and our membership with the IPS International Learning Community. My team will tell you that they find participation in that learning community, that collaborative, to be very critically important. Members get to share their experiences, their program data, lessons they've learned with each other. And they meet bi-monthly. Currently, Kentucky is interfacing with about 26 other states, 6 other countries, and then some various cities and other folks, and they just get a whole lot out of that. If you want to go ahead and advance to the next slide. Terrific. So I'm going to talk for just a minute about kind of how we've adapted to COVID, and really same thing we're doing here, right? Everything is virtual now. So our IPS trainers have been having weekly Zoom meetings with all of our sites just to offer assistance during this time. Our team provides regularly scheduled virtual training events, and technical assistance is also done virtually. There's a couple examples here of things just, you know, facing the challenge of change, documentation, time management, all those types of things are being done virtually now. We've also developed some very specific tip sheets for the teams, how to stay connected with clients during the pandemic, tips on job development during the pandemic. We've been providing virtual technical assistance specifically to help people get ready for their virtual fidelity reviews, which we have been doing some of those reviews, and they have been going pretty well. Some sites have given us passwords so we can go ahead and access medical records, and other places they upload it for us, but we've been able to figure that out with all of our providers thus far. We had to cancel our annual conference, unfortunately, but they did do a big celebration for celebrating our 10 years and to make sure that our annual award recipients were recognized. That was done virtually. There was a slideshow and a video that was a big hit, and we're currently in the process of planning a virtual quarterly employment specialist get together. So they are still getting together on a regular basis, which is nice. And on the bottom of this slide is just some feedback we've gotten from one of our teams, just impressed at how the state IPS team has been very proactive during COVID and making sure that we're keeping clients safe. If you could go to the next slide for me. So this is, really is about the right people, right? It's about having a great team, and we do have a great team here in Kentucky. This is a picture, of course, taken pre-COVID. And you can see we've got 4 trainers, 2 fidelity monitors. We have, again, a representative from behavioral health and one from OVR. Ron O'Hare, the only gentleman in the picture, is our current OVR rep, but 3 other members of that team previously worked for OVR, and one of those team members was previous executive director for NAMI Kentucky. So these are people that have done this work for a long time, really dedicated to what they're doing. They have a lot of passion. I also just wanted to mention that Kentucky is an employment first state. The original order was executive order from the governor came in May of 2018, but our current governor just earlier this month has also written an executive order for us to be an employment first state. And we think having that kind of support all the way to the very top of our state government is so critically important. And so we enjoy that support quite a bit. With that, I'm going to turn it over to my colleague, Cora McNabb from OVR. And I think she'll need you to go to the next slide.
Well, thank you, Wendy. And, that picture, I think, says it all, because it is about the right people. And you all know from delivering services yourselves that when you get the right people, then you get the right services. And, it is all about having a model that the focal point is about a team approach. And for us, we work together to implement and support IPS in Kentucky with DBH. And I have to say that the Department of Behavioral Health has the lion's share of the responsibility. However, vocational rehabilitation is a crucial partner in all of that. The vocational rehabilitation counselor, and then I would be amiss if I didn't reemphasize what Wendy said about leadership, because I think you have to have buy-in on every level in leadership. And we have Ron O'Hare, who is the community rehabilitation provider, the branch manager. And when you have people that have a passion about something, then good things happen. So in Kentucky, the VR counselors are a vital part of the team, and they play a huge role. They attend the local meetings, the monthly steering committee meetings. They participate in the fidelity reviews, which, those are very important in ensuring that there is that ongoing teamwork that builds all those interrelationships. They also participate in interviews when out in the state, the community rehab providers are hiring IPS staff. So that gives them input and buy-in on a local level as well. And the OVR counselor you know, as a part of their guidance and counseling, they're skilled to identify and address other vocational needs. And they have to be knowledgeable about local resources that need to be given to the individual. So they work in conjunction with the rest of the team members in carrying out those duties. Looks like we lost our PowerPoint, but I can keep talking, keep right on talking without it. I think having the VR counselor involved on, you know, in the team meetings gives, you know, them, like I said, local input, and it brings different perspectives to the team as well. You know, anybody, it's different because it's not just the community rehab provider providing the needs for that individual, but it's an entire team that can be made up of the VR counselor and the mental health worker, the trainers, you know, it's a very much a team approach. And as a result of that, you have a lot of really good interpersonal relationships that develop. Well, we lost the slide about that focuses on the funding. That might come back up here. But I can tell you that in addition to some of the things that OVR brings to the team for, you know, they contribute in a lot of significant ways. One of the ways in Kentucky is that we make payment to the IPS providers for the services. And here we go. So OVR will authorize for the services to the IPS provider, and then the provider, of course, bills us for those different milestones. And we have up here a quick overview of what those are. And we use the service fee memorandum process that outlines payment. And you can see the career profile is a payment point of $450, job development $900. And then you have the 30, 60, and 90 successful outcomes that, you know, are 1,000 and then 2,000 for both the 60 and 90 day. And then there are some additional services that are bonus payments. So if the employer provides coverage above a certain point, then there is a $500 bonus payment. And then also there is a $1,000 bonus payment for those targeted wage, the targeted wage if it's a 1183 or above. So you can go on to the next slide if you would. We just wanted to put a slide in here. One of the things that I mentioned that is really important is those interrelational, you know, relationships that happen. And because of that, it promotes, you know, a stronger team of individuals that are supporting the person. And these are just some of the things that IPS services, some of the quotes that we have to share with you today that talk about the good work that the staff do. The first one is they are supporting of the decisions I make, and this keeps my attitude positive. They support what I want to do, and that's nice to have from somebody. Everybody wants to be heard and supported in what they do. When I first got out of prison, I didn't know how to react or what was out there for me. Now I have a great job. Mike really got it done for me. I love my job, and Kay calls me at work to see how I'm doing, and I get along great with everyone at work. I don't know what I would have done without Bridgehaven. And then during COVID, as we've already mentioned, we tried, you know, to get creative. Excuse me. And one of the employment specialists actually went through the drive-through to check on her person that was working. So an employment specialist providing support to a client working in fast food went through the drive-through to provide support. And then finally, excuse me, an IPS supervisor, employment specialist and client had a job interview via Zoom, and the client obtained the job. And so we're trying to be innovative in our approaches using different platforms to reach out to individuals. So next slide, please. So this is our final slide, and you can see on here the website for the Kentucky IPS Toolkit that's been developed that we wanted to provide for you. And then also, as mentioned, you could visit the International Learning Community website for more information. And then we've just listed here the Kentucky IPS contacts for you. And again, thanks for letting us present to you today about the project in Kentucky that we're really proud of. And I have to say, it is the staff and the teamwork that has made it so successful. I'll turn it over to the next person.
All right, I think that's us here in Ohio, just to your neighbors to the north. I'm going to share my screen. We'll see how this goes, right? I have a lot of things open. Sorry about that. It might just be easier for you to share the screens from your side, and I'll say advanced slides if that's okay. So I think, as Kevin and I talk about what's happening in Ohio, you'll see a lot of similarities with what's already been said. And I'm really grateful that Director Miller is here today because it really has been a true collaboration for years between the vocational rehab services system and the mental health and addiction services system. So it's great to be here with you, Kevin. Next slide, please. I think the other thing that's important to echo is that this really does have its greatest success, supported employment does, when it comes from the top. And Governor DeWine really does expect that we, as his team members, are focused on recovery-friendly communities that are available to support all Ohioans in health and wellness. And so we are striving to have a system where we know that acute care is necessary, but it should be brief in its duration, and that we are reinforcing health and wellness and recovery opportunities throughout the state of Ohio, and supported employment is a big part of that. And Governor DeWine's leadership is driving that for us. Next slide, please. So just a brief look at supported employment in Ohio. We joined the IPS learning community in 2005. And so we were early adopters in this process and have really appreciated all of the resources, technical assistance that's been available to us. And over the past, I would say, 10 years in particular, Ohio Department of Mental Health and Addiction Services and the Opportunities for Ohioans with Disabilities team have really established a great relationship at the state level and have made significant strides in building those relationships at the local level too. I have only been with the state since 2019, coming in with Governor DeWine, but Kevin's been with the state and really did a lot of that focused work in building this relationship with the departments. And so I'll let Kevin talk about that a little bit if you'd like to add anything in here, Kevin.
Well, thank you. And let me just echo to Director Criss, a longtime friend, and she was a leader with the Ohio Council when we were partnering when she was in the private sector. So it's great as when Director Criss talked about having that support at the top, we are also an employment first state, as well as the governor signing just moments after he was sworn in an executive order saying Ohio would be a disability inclusion state and a model employer. So his expectation, as Director Criss and I both sit on the cabinet, that's not often that you see that structure in other states where both the director who oversees vocational rehabilitation and mental health having separate agencies, both being appointed and sitting in the cabinet. So when Director Criss talks about that community partnership, it really has a tremendous amount of buy-in there at the top.
Yeah, thank you, Kevin. Next slide, please. I just wanted to share a specific story, and this is Connie Darby, and she came to a mental health center for clinical treatment, and during that expressed an interest in working again, but also wanted to keep her Social Security benefits. And so it became really important to Connie to drive towards that employment goal as part of her recovery plan. And her supported employment specialist with New Horizons Mental Health Center linked her to the OOD vocational rehabilitation services and the benefits available through that. And they were able to wrap supports around her and move her quickly to competitive employment through this partnership between the mental health center and the team at Director Miller's agency as a way to support Connie and her recovery goals. She applied and got employment promptly, and the team helped her with resume development, job application, filing, following up, and met with her weekly initially, but now support her biweekly and much shorter bursts of services and supports to help sustain her employment. And she works with service masters. She's providing cleaning and custodial services for a school and a medical practice in Central Ohio. And her employer and the clients and customers she serves just love her and really appreciate her engagement and excellence in her work. So this is Connie, and this is her quote about how her employment experience has helped her manage her symptoms and sustain her wellness. So next slide, please. So key to our successes and outcomes are really the engagement of stakeholders and community partners, building that partnership at the state level between Director Miller's agency and our own, where we are both committed to contemporary and common sense approaches for regulation and for financing, to making sure that the clients are getting the support and services they need of the highest quality, and the providers are getting the technical assistance and training and the financing they need to really drive excellence in their work has been a cornerstone of that. But also working with those providers in both the vocational rehabilitation services and the mental health and addiction services to identify what barriers are in existence and work through them has been incredibly helpful in spreading the opportunities for vocational rehabilitation and support employment services across the state. So we are focused on helping to sequence funding. So looking at the VR funding first and its focus and its sort of temporary time limited nature, and then filling in with local resources through our mental health and recovery services boards. We have 50 units of local government around the state that invest in many investing in supported employment, and then staggering on even further other private philanthropy or investors like the United Way or other foundations to sustain that wraparound over a long period of time. We also put consistent and significant effort into relationship building, technical assistance, and training with the provider community. And it's not just the didactic material, but it's those connecting partnerships. So at the last bullet here, you see the Connecting the Dots training program. And this was an opportunity to take the employment first strategies that Director Miller has referenced and the disability inclusion state status that we have, and overlay that with the Recovery Ohio initiative that Governor DeWine also initiated on his first night in office, and the collaborative work across all administrative agencies to really help local VR partners and mental health partners work with the IPS supported employment evidence-based practice and learn together how each other's systems work, what the evidence suggests is the most effective way to approach employment, to create common language, to understand one another's administrative and documentation requirements so that they can streamline administrative practices to make it work more seamlessly for the person who's pursuing the supported employment services. Again, just making it common sense and contemporary and trying to get unnecessary barriers out of the way. It really does help to make the practice easier at the provider level. And then Director Miller's agency has assigned a VR counselor to each IPS team, which allows them to build a very specific relationship in those local communities, local provider agencies, and in supporting the men and women who are engaged in those services. And staff were able to volunteer for that based on their experience, expertise, or interest, which just lent that much more passion to the work. Anything you'd want to add here, Kevin?
You're right on point. You're right on with my talking point. So I was just going to say ditto. The only other thing that I think is really important to point out is when Director Criss is talking about the flexibilities and talking, actions speak louder than words. And so when you see the idea of implementing waivers for accreditation, this is showing culturally, especially within vocational rehabilitation, there hasn't always been such a open-armed approach when it comes to individuals, especially who might have substance use disorders. And so culturally, when we're seeing this type of opening that goes back, I've been here for 9 years as director, it's really come a long way. And by giving those types of waivers to have somebody who has that specialty in the private sector from mental health has only increased our base and brought more services in competition for those that we serve. So I just wanted to echo that.
Yeah, thank you. So next slide, please. So here is, building on what Director Miller was just talking about. It's not just to talk about it, it's to actually demonstrate it and act on those values and shared vision and goals and practices. We have an interagency framework that we use at the state level to guide us, and I'll let Kevin share a little bit more about that. But I also want to just comment quickly that we are a home rule state, and we have local communities and local governments who are helping to implement this work. And we have a lot of diversity in population, geography, the availability of resources in rural and Appalachian communities compared to metropolitan, urban, or suburban communities. And so we strive to create a framework at the state level that's flexible enough for each local community and those local partnerships to be successful within this framework. And our goal is to create standards of quality that will work across the state, but recognize that how each community partnership implements it might look different in every single community, but we're really looking for those goals and those outcomes. So do you want to talk about the interagency agreement a little bit, Kevin?
Yeah, Lori, thank you. I think one of the key things when you talk about buy-in is when you see an interagency agreement where it's something that's signed between the two agencies. And when Lori talks about that we're a home rule state, we have 88 counties. And so as Lori said, you have some counties that or a little more robust in what they have as far as funding, how they're structured. Some mental health boards are combination boards, some stand alone. And so the idea of being able to have an interagency agreement just lays out the fact that VR and mental health and addiction services, and putting it in black and white, talking about IPS and how we are involved in fidelity review manuals that we put together and a crosswalk for everybody to understand and see, the joint trainings that Director Criss and my staff have had together, very similar to what Director McNabb was saying in Kentucky, goes a long way as far as someone who wants to come in from a provider standpoint and be a part of this. It's something that's proven. It's something that is evidence-based that, and so many times I know as administrators, we want to be able to point to that, especially as I heard from the earlier presentation, we're all going to be facing, stringent times with the budget. Having something that is evidence-based really goes a long way. So having those meetings and the data sharing, I think, is really the key component when we talk about what is in that service level agreement. States right in there what we would be using it for, how we want to be able to use it, and it keeps transparency at the forefront of it.
All right, next slide, please. So I'll just put this here so that you know it's available when you're looking through how Ohio engages with the IPS Employment Center, but certainly Dr. Drake's here to answer questions about it, and our colleagues from Kentucky have already talked about their connection to this work. So we'll move past this and really want to talk for a minute about a new initiative on the next slide with the DeWine Husted Recovery Ohio strategy, which is to support recovery, prevention, harm reduction, treatment, and recovery through all state agencies and relationships among us. And Director Miller and his team put together Jobs for Recovery, and I'll let him walk through this initiative. It's new and it's exciting and it's having great success.
Thank you, Lori. You know, one of the things that the Governor DeWine really presses, and it's something that as a director I do as well, as I know Susan Pugh, who is our Deputy Director of Vocational Rehabilitation, is on the call. She will tell you culturally, we're big on trying to make sure we're doing things that's not really thought of, pushing outside the envelope and making sure we're making a difference, not just to make a difference, but to make sure we show we're big on measuring things and showing that there's a need. Well, I'm sure Director Criss will tell you Ohio has been, unfortunately, in the national spotlight when it comes to some of the substance abuse issues and drug addictions that are going on in our state for quite some time. And so Governor DeWine challenged everybody to say, you know, I don't want the same status quo. I want to think about things that can really make a difference, something that's innovative. And in my past life, as I like to say, many, many moons ago, I won't say how many moons ago, but I actually started my career in the corrections field. And so I've been away from that for quite a while. But as we started to revamp our service delivery model some 9 years ago, about 5 years ago, we had an opportunity to have a very innovative judge in Southwestern Ohio who was interested in approaching us about, you know, I'd like to provide money actually for you to be able to match and then basically buy a counselor, so to speak, to work within my what's called an alternative docket, in layman's terms, a drug court. And so we were all about trying to do something like that. And so from that, Judge Spaeth, who is the judge down there in Butler County, which is not far from Cincinnati, has had tremendous success comparatively with regular, what we would call traditional VR cases, even higher success rates. And so when Governor DeWine was elected last year in January, it'd be 2 years ago almost now, this was something that we brought to his attention as someone who Lori will tell you is very dedicated to the substance abuse work and recovery and treatment, and also individuals with disabilities. So this really fit together like a glove, hand to glove. And so we brought to the governor, listen, we have an evidence-based model, much to Dr. Drake's, I'm sure, affirmation. When you have something like that, it's a great way to build from it. And so we asked to secure some additional funds and replicating this model that was being done in Butler County with other counties, and that it would be used utilizing the IPS supported employment model to engage individuals. As you see, I'm not just going to talk what the bullet points are there, but so we've expanded that to 7 counties. And I've met personally with every single one of the judges. I don't know if any of you have ever had an opportunity to work with judges, but judges are kingdoms or all to their own. And so judges want to make sure they understand that there is something of value in this. And you know, I've had judges say, you know, I have a lot of state agencies or local entities who come in thinking they want to help and they're more of a burden. Well, luckily that is not something that has been said about the Jobs for Recovery initiative. As you can see by our numbers, this is something that you build. You know, in vocational rehabilitation, it's not like you just turn on a fire hose. You have to build relationships as you go through this. So we've been able to build a caseload of about 185 cases. We've got about 44 individuals who are currently looking for employment. I would probably tell you that number has decreased because we're constantly every week placing more and more people, even during this pandemic. We've got 14 people who are employed but haven't reached the federal standard to say that we can count them as being closed, and 8 of them have successfully closed and exited the system, all along while being supported outside of the VR process through the court's local probationary departments, mental health departments, substance abuse providers, and counseling. Everybody sitting as a team. Our counselors sit usually weekly meetings doing case reviews with those individuals who are brought before the judge on status reports. And so this is something when you look at sometimes many of these individuals had a previous career, and it's just a matter of getting them back into place and getting them with some supports so that they can resume that career. For others, it's about, for the first time, really doing something, in their words, that is constructive and not illegal. And so the vocational process with that can't be done without, obviously, the court making sure that they're staying clean and making sure that they're still progressing in their treatment, as well as the mental health and substance abuse team who are doing everything they can to make sure that they're a part of the vocational process so that they're playing for employment. You know, for instance, one of the things culturally we were looking at is if this was somebody who traditionally worked as a bartender and they have a substance abuse problem, this would be something where we would say we need to look at a different career change, and that would be developed and worked on as part of treatment with the substance abuse or mental health team. And so that was a real learning experience that culturally our counselors, understanding the IPS model, getting involved more and more on a case-by-case basis on what those services needed to be, only enhance our ability to help. Lori?
Yeah, thank you. It really is a great program, and it's been wonderful to be able to build off of the IPS success and reach people with substance use disorders specifically. So our final slide is next, I believe. And, you know, you heard this echoed through all the presentations today. It takes that leadership from the top down, a belief that employment is part of recovery and relationships throughout to make those successful. So we appreciate the opportunity to be here with you today. And again, thank you for the time, and grateful for the chance to be with these other presenters too.
Thank you so very much. What rich presentations. I love the quotes and the experiences. You all really brought the partnerships alive here on how it really works, and really, really appreciate it. Have a couple of questions. One, many leaders recognize that supported employment is, part of recovery, if not even essential, to help people, stay out of crisis or help stabilize after a crisis. But at the same time, others in the state, including some providers, may not recognize this essential role of supported employment. So what is the best way to educate other system leaders and providers about this important role of supported employment? Any thoughts on that?
I'll take a stab at it. I think it really goes to, in this day and age, and especially unfortunately with the pandemic, Director Criss and I will tell you, when we have to go before the legislature and talk about our budgets, and I tell our staff, I tell our providers in the community that basically what we're doing is we're asking a legislator to decide what to do with a dollar. You can use that as an euphemism. It's millions of dollars, but each dollar they have to decide, do I give this to education? Do I give this to public safety? Do I give this to, vocational rehabilitation? And so the difference is when you can come in and show results, when you can come in and say, here's evidence-based practices. These are things that usually separate you from other agencies that are coming in to say, this is why I have to have this or this. So to me, I think that is your best calling card to try to get buy-in from your other providers, knowing full well, here in Ohio, you're not going to reach everybody. I think part of this is how I approach things. I'm not looking to try to get 100%. I can't, put 100% of my effort into the 10% who don't want to believe. I got to maximize my efforts for the vast majority and be able to make sure we show that what those benefits are. So that would be my recommendation.
Great.
Yeah, I was on that slightly and just say that focus on recovery and wellness and moving away from acute care and anything stigmatizing. So not just the supported employment piece, but that as part of a more robust package around purpose and connection to community. And that's what all of us need. That's what all of us want to be healthy human beings. So not making it separate and apart as a special initiative, but it's housing, it's peer support, it's meaningful engagement, people, places, and things. It changes the tone of the conversation and helps bring people along. And it's not a reward at the end of successful treatment. It's part of the recovery process throughout the person's experience, and they drive that is another important part of it as well.
Yeah, and I was going to say something similar. I mean, I think people understand supported housing, right? Housing first, and making sure that we're addressing people's need for safety and security, a place to lay your head at night. But supported employment is equally important, and for some people more important. It's about having purpose, and it's about developing natural support so that you don't have to rely on state resources and other kinds of supports. But those natural supports are critical, right? And a person might determine where they want to live based on where they find that employment. So I know for us, where we transition people out of congregate settings as part of a settlement agreement, employment is sometimes the key to getting people out of a congregate living setting, because that's how they start to develop community supports and where do they want to live? Is it on the bus route to my job? Where do my new friends live? Those types of things. So I think it's yeah, definitely part of recovery and part of that process.
Great. And Cora and Bob, do you have any thoughts on this? And then we'll wrap it up there.
I was just going to say that just like what Director Miller said, his point is one that I always try to make. And then I always also think about, an individual recently that I was talking to and, indicated they would like to have help deciding where they work. And when I asked them why, it was, well, to earn some money. And you ask them, well, what would you do with your money once you earn it? And And she said, well, I really don't need money, but I do want to feel proud about myself. So I think that's very important. And then a lot of times with individuals, I just say, you know, you and I are no different than anyone else. We're no different than any of the individuals that we serve. I could walk out of my house tomorrow, be in a car accident, sustain a traumatic brain injury, and be someone that needs those services. So a lot of times, you know, just making it personal for individuals, because we all know that sometimes things aren't really impactful on us until we experience them or someone that we're close to experiences that.
Thank you. Bob, any last words?
Yeah, you know, support employment is tremendously important to individuals in their recovery process. It's also important to employers because most employers have the need for part-time employees. It should also be terribly important to the governor's office because it's a cost-saving intervention. And it's not just cost-saving, but also people who are employed are paying taxes and they're being good citizens and they're integrated in their communities rather than, you know, hanging around and drinking and doing drugs. You know, all of these things fit together, and it always surprises me that at the governor's level, they don't really pay attention to this and take responsibility for integrating all the different programs and offices that need to work together on this. Thank you.
Well, thank you all very, very much. This is I found this a very inspiring presentation and a reminder of the inspiration and hope we can give people in their lives to live in the community and a quality life for that. So thank you very, very much. We're going to wrap up here. Brian and Valerie, did you want to say anything before we put up the evaluation? Or should we go straight there?
No,
Looks
just
like
to,
we should.
just
Yeah,
to
go-
reiterate what you said, Megan. I mean, employment is so important for individuals in their recovery, and so this was really a great presentation. Really put a fine point on that, and I certainly appreciated it. Thank you.
Yeah. Great. Well, thank you very, very much, everybody, for attending today.